Pinay again. This video is for the medical fees in the Philippines. I actually received two emails regarding that topic. I cannot find my eyeglasses. So he said, the first one, he said the girl was asking for 2,000 pesos to pay a medical certificate, and then the other one was asking 60,000 pesos for an operation, gallbladder. So it's like this. He said, I do have a question, and it involves on how the Philippine medical system works. The reason I ask, I believe that I had an attempted scam upon me. The lady friend told me after 2 to 3 months of online, she had a stone in her body, and depending on that moment, either in her gallbladder, liver, or kidney. She doesn't know. Her English is not as good as yours. Anyway, she asked to help raise 60,000 pesos for operation she would need. When I mentioned paying the hospital directly, I was getting reasons that it's not possible. I told her no and told her I could no longer continue the relation. Good. My plan was to visit in October. I no longer trusted, and other reasons to no longer trust. My real question though is, do Filipinos who are poor die of lack of medical care and financial resources for a simple procedure such as the removal of gallbladder? How does the medical care for Filipinos work, which I imagine involves national plan, private health insurance, direct payments to hospitals and doctors? Once again, yeah, those. Okay, let me fix this. Do you guys understand? I read too fast. Anyway, his question is, Filipinos who are poor die of lack of medical care, financial resources for a simple procedure. And how does medical care for Filipinos work, which I imagine involves national plan, private health insurance, direct payments to hospitals and doctors? First of all, I would like to commend you for realizing that scam instantly, and I'm quite, glad that you noticed that. First, because you said, it was either in her gallbladder, liver, or kidney. She didn't know where it is, right? And then she gave you a price of 60,000 pesos. Guys, while I was making these videos about scams or whatever, I have talked about them in my book, but it still makes me feel uncomfortable, and I cannot believe that it really goes this far. This amount. I've heard, extreme ones from other people, but from someone telling me directly, I feel like, I feel really ashamed. I'm sorry if, anyone who has been scammed or something. Just sorry. I cannot do anything about it, but sorry about that. So, you were asking about the medical situation in the Philippines. First of all, yes, I would say that poor Filipinos sometimes die because of lack of medical care and financial resources. But there is a way. Just they don't know who to ask, where to go. Why did I say who to ask and where to go? First of all, my mom, during the time I call it depression time in our family, she had a cancer. But because my stepfather knows where to go and who to talk to, they were able to secure her operation. Her operation normally would cost, and chemotherapy would cost about 90,000 pesos, but fortunately, my stepfather went to Philippine General Hospital. The thing is, my mom has to be in a waiting list. Fortunately, she was in a waiting list that is a little bit, in a good list. Like about after 4 to 5 people. Plus, there is always a specialist who would look at you. And then these specialists, they are usually for free because it's a public hospital. The only thing that you would pay in a public hospital would be the medicine and the place. If you're gonna be an inpatient, is it right? A patient, inpatient, not outpatient. So the normal fee for a ward would cost about 400 pesos plus the medicines. Now, but don't get me wrong, all hospitals, private or public, they charge the room fee, and at the same time, the medicine, you always have a choice if you will buy it. It's like this. My family is always getting sick, so I know some things about that. Example, I'm the doctor, you're the patient. I'm gonna give you an option. If you want to be an inpatient, you have to pay for the room. And then, as for your medicine, this is a public hospital setting. For your medicine, you don't have to. It's up to you if you will buy in the hospital, like hospital pharmacy, or if you want to go outside to buy it, which is sometimes cheaper. And then you can give it to the doctor, and then if it's injection, they will inject it on you. If not, you can take it orally, and then they will give you instruction. Now, in a private setting, it's the same, just it's more expensive. And at the private setting, you have to pay your doctor's fee, the room, and as for the medicine, you always have a choice where you will buy it. So, in that situation, my mom, in a public hospital, it's kind of uncomfortable if we will talk about that, but it was really helpful for her. Plus the specialist was kind of, he's a good person. Kudos to that guy. He saved my mom. But anyway, yeah. Usually, if you go to a public hospital, checkup, those things, doctor's fee is always free. The only things that you will pay for are the medicine and, the other things, like if you will stay in the room, or like dextrose, syringe, those things. And they are cheap outside the hospital. And then you are asking me, some people die because they don't know who to talk to and where to go. And then, but if they know where to go, they will not die. Plus, here's the thing about Filipinos. They will only go to the hospital if it's really in, worse, bad situation. I'm guilty of that. Why? Because, it was embedded in our culture, and with the people, that being in the hospital is expensive. But with my experience, it's not really expensive. I have experienced public and private hospital. Public hospital, I stayed 1 night. Private, I stayed 4 nights. Of course, I paid a lot with the private hospital, but with the public hospital, it was the only thing that's scary is that in Angeles City, Pampang, if people know that, someone tried to steal my phone. So next day, I told them I want to get out. It's really scary. Only that. But so far, the doctors would still do their jobs. And then, the national plan. Okay, that is the national plan. The national plan is that all doctors are required to attend a certain day in a public hospital. And then, do they have a health insurance? Yes, we have a public health insurance. It's called the Philhealth. Now, for those who has a Filipino girlfriend, family, wife, whatever, it's better if you get her a Philhealth. It has been very helpful for my family. You can use the service after 1 year of paying. What are the benefits? If I'm not mistaken, you would end up paying only 30% of the fee. of the total fee, so that plus the medicine, even if you're in a public hospital. And sometimes you don't have to pay for anything else except for the medicine, even if you're in a private hospital. My aunt in London, she knows this, this service, and then what she did was she got some of my aunts, and especially my grandma, their own Philhealth. And just a few weeks ago, my grandma was in the hospital, and Philhealth really did do a great, job in slashing the amount for the expenses, because my aunt has experienced one of her sisters getting sick and paying about 60,000 pesos cash in the hospital. So she doesn't want that to happen again, but it does happen. Now, how do you get Philhealth? You get Philhealth, those who are working, they usually get it, especially if it's a company, the company shares the payment with them half. So if it's 150 pesos per month, they would pay 75 pesos, 75 pesos, 75 for the company, 75 for the employee. But it's very, very useful, believe me. And then you can have up to 4 dependents or 3 dependents. So it means if I am the mom or I'm the father, I can put my wife and my 2 children as my dependents. If I am the child, I can put my mom and dad as my dependents, or my brother or sister. So yeah, it's really helpful. Now, if a person is not working in a company, they can still apply for this. All they have to do is make sure that they pay the monthly fee, which is 150 pesos. After 1 year, they can use that insurance. Believe me, it's very helpful. At first, I was skeptical, but when I saw, I think my family is always getting sick, especially mother's side. So yeah, when I saw how much it helped our family, I would recommend Philhealth. But some people think that Philhealth is not really useful because they have to pay like 150 for nothing. They still feel that 150 is a little bit big. And some people, even if they have Philhealth, they are registered and then they don't pay monthly, and then they end up, not having to use it with emergency situation. Some people think that they will never get sick. That's why unless they are in a company, they will not really, do anything about it. They'll not try to get it. Now we have the private insurance. These private insurance, I also had this before. We called it Medicare, but there are other names. These are also provided by the companies usually, and sometimes, of course, normal rich Filipinos or middle class also have the access to this. The good thing about Medicare is that you can use it not only for like health related services, but also you can use it for your tools, to fix your teeth, like that, cleaning. Those are covered by the Medicare, unlike Philhealth. Philhealth is usually only for big hospitals like that. But Medicare really does a lot of, since it's private, because you're paying more than how much you pay with Philhealth. I remember I pay like about 120 pesos a month, and I already shared with the company in that amount. That is when I was working in the call center. Did it help a lot? I guess so. Not with me, but my cousin got sick. We work at the same company, NCO, and then he got sick, and the Medicare covered everything. So it's really good. And then direct payments made to the hospitals and doctors. This is the thing. To the person who asked the question, I want you to know that it can be possible for big hospitals like St. Luke's, private big hospitals. It is possible to do that. But for public hospitals, I'm not saying it's impossible. The only thing is that Philippines is still a paperless environment. I mean, it's still a paper system environment. Unlike in the United States, you can pay by credit card, debit card, whatever cards you have. Even in Japan, cards are very important. So in the Philippines, even if, you know, maybe you want to pay overseas directly to a public hospital, I guess what you have to do is call the hospital itself and ask them if they can accept it. But usually they prefer cash because only few hospitals, especially public hospitals, accept, you know, paperless environment. I think that's why she said it's impossible, but it's not exactly impossible unless you make the right calls. And as for the other one, the private hospitals, they cost more. That's why, remember the 60,000 pesos I told you that my aunt spent for an operation? She used a credit card with that. It's a private hospital. All you have to do is call the hospital, ask them if they can do it, do the operation, and then you can send the money, not exactly online, but in their bank account, and then send the receipt. She can bring the receipt and show them that you paid. So it's not, again, it's not impossible to do it, to pay directly to the hospital. Not impossible, but not all hospitals can do it, because not all, I think only 50% of Filipinos, 60% of Filipinos has a bank account, a debit or a credit card. That's why it's not yet very important for hospitals to have, you know, an ATM, a system that would accept online payments or such things. But there are many private hospitals that accepts those cards. So I think I think it's also a scam. If I am sick like her, I would find a way for you to find a hospital where you could send the money directly and just get on with my operation. But if it's not, since she wants it in cash, plus unless you have a consultation, you'll never know how much it would cost, really. I hope that answers your question. I'm not really sure if I answered it properly, but and I'm sorry if I'm a little bit babbling or something like that. I'm not really feeling well, but it's Tuesday, so I have to answer, and my questions are piling up. The last video that I'm gonna make is about internet.